Hello, my name is Isabel Newton, and I'm an interventional radiologist at the VA in San Diego and also at UCSD. And it's my pleasure to offer you our case review today in IR. We're going to kind of fly through this. I'm also going to pepper it with some radiation safety. So first case, this is a 72-year-old man. He had a history of polycystic kidney disease, and he got a kidney transplant from his daughter, who happened to be an IR nurse 5 years prior. And he came to the hospital with acute kidney injury. His creatinine was up almost double. His white blood cell count was normal. He had normal platelets and a normal INR. So we performed an ultrasound of the kidney, and this is what it looks like here. And of course, transplant kidneys are usually in the right lower quadrant. So this image here just shows you the native kidneys with the polycystic changes, and there's a cyst also in the liver. So I'm going to show you a series of pictures for pre and post intervention before telling you what the intervention was. So here you see a Doppler image of this transplant kidney, and there is reduced perfusion of the periphery of the cortex. Afterwards, there's much more homogeneous perfusion throughout. And again, here are some recordings from the vessels that are supplying the kidney, this lower pole, the main renal artery, and the iliac. And you can see pre-intervention, there's depression of these waveforms and improvement afterwards. We have normalization of the waveforms at all levels after the intervention. So what's the cause of the patient's AKI? So I'm going to show you, here's some pictures from the patient's CT. I still haven't shown you the CT image of the kidney, but that's not really relevant to here. So here you see the distal aorta, and you see a lot of atherosclerosis and a big old chunk right there at the ostium of the right iliac artery. And this is, of course, the iliac is where they plug into and attach the vasculature of the transplanted kidney. So this is a case of obstruction to the kidney due to atherosclerosis of the native arteries. So what do we do? First, how are these images generated, and why would we maybe use them? This is CO2, and we use it when we don't want to use contrast because we're worried about contrast nephropathy. Now, I want to understand fully that the whole topic of contrast nephropathy is under debate, but we do tend to use it still until this is established in cases where patients have borderline renal function. So here you're able to see, this is the distal aorta. We have a pigtail catheter, and we change the settings of our machine to be able to detect the CO2 with a subtraction image. And you can see that there is non-opacification of the ostium of the right iliac, congruent with what we saw before on our CT.